Hello and welcome back to another episode of the Live Homage Web series. My name is Tanisha and I'll be your host for the session today. In today's episode, we'll be talking about depression in the elderly with Professor Dr. Esther. Professor Dr. Esther Ebenezer is the professor in psychiatry at UniKL Royal College of Medicine, Perak, and she's also the consultant psychiatrist at Pantai Hospital Ipoh and Ipoh. She's a prominent figure in the field of psychology for her excellent work in psychiatric disorders and dementia. So thank you so much for your time with us today, Dr. Esther. To start us off, could you give our viewers some insights to the elderly and depression in general?
Good evening to all. Good evening, Homage, for arranging this talk of today. We are going to talk about depression in the elderly. I would like to introduce you an idea about what is age group people. According to World Health Organization, 65 years old and above is considered an elderly age group. Further above 65 is divided into young old, middle old, and centenarians. So those 65 years and 74 is called young old. 75 years to 84 is called middle old. 85 years old to 99 years old, they are called old. And those above 100 and above are called centenarians. Yeah, this is a heterogeneous group of people where among the elderly, some can be very fit. At the same time, some can be really very frail. So this different group of people that comprises of. So there are a lot of challenges with aging. Depression is one of the common problem that we encounter among the elderly age group. If you could see the world survey of depression among different age group, you can see it among the elder group. 50 years and above have 6.0% prevalence, and 70 years and above got 6.2 prevalence of depression. If you can see this figure, the elderly age group has prominently more prevalence of depression compared to the other age group. So it is timely, it's good that Homage has arranged for this public forum so that we can discuss about the elderly depression. Okay, so elderly depression is something different compared to the young depression. Yeah, so probably I would like to have the next slide. Probably I will tell you about the causes. What are the common causes of depression among the elderly? So when the person grows old, the brain structure changes happens. The brain cells, these are called neurons. Each neuron has its own function in producing some neurotransmitters or chemicals that is responsible for us or for anyone to feel happy. So when the brain changes happens, the biochemical changes also happens in the brain. The amount of serotonin, norepinephrine, noradrenaline, all these neurotransmitters become less and less. So the person can become depressed. So it is a biological process that can happen in an elderly age group, and they can have decline in functioning. In the past, they can drive around, they can do marketing, they can do housework. Now they have to depend on other people for their normal day-to-day function. So they become very much dependent on that. Other people, they can feel very much sad about it. They couldn't cope with that loss of their functional ability. And bereavement also one of the major cause for depression among the elderly. If an elderly couple, one passes on, the other will find very difficult to cope with life, especially if they are very much close couple. They depend on one another for emotional support or any other support, very closely knitted. I have seen quite a number of my patients who are very close couple. When one passes on, the other one really suffers. Yeah, that is also a main problem among the aged group. And if the death is sudden, like suddenly had a heart attack and the person passes on, and the person is not prepared, the other spouse is not prepared for the loss, so that also a high predisposition for depression among the elderly person. If a person is sick for some time, they slowly come to terms with the person's disabilities, and they are ready to take the bereavement in a better way compared to those who passes on suddenly. Okay, elder abuse, very very much it is underreported. Unlike the child abuse, it's much highlighted. Yeah, so the elder abuse can be physical abuse, pinching, hitting, um, physically abusing, or verbal abuse is also, it's equally bad. Verbally abusing the person or psychologically abusing, giving them the fear of being neglected, fear of being abandoned. So all these are psychological abuse. And financial abuse. Elder persons, when they retire, they have fair bit of money in their EPF. The children, relatives, friends, they used to con these people, elderly person, all their life savings are gone. They can become depressed. And there are reported cases of sexual abuse among the elderly. So apart from that, there are a lot of physical problems sets in as the person grows old. So to live with physical illnesses is difficult. So that is also one of the common condition reason for person to develop depression. And a lot of medications can cause depression. So that is also one of the factor we have to look into it. And institutionalization, if the children have to go abroad to work, or the children have to leave them, the elderly couple or elderly mom or dad, they couldn't take care of themselves, they have to end up in nursing homes or residential homes or institutions. That can cause a lot of trouble among the elderly people. They find very difficult to cope with life. They'll have to leave their home, sweet home, where they have been living many years. So it will be a big impact for them. Social isolation, yes, it's a big issue among the elderly age group people. I can see quite a number of our residential area where the elders are left alone, where the children have already migrated to different states to work or even different countries to work. So this is also a major factor. Loneliness not only causes depression but also can cause memory issues or dementia also. It's one of the risk factor. Yeah, so relocation is another problem. Family members, they couldn't cope with their life alone, elderly person, they decide to follow the children to live in Putrajaya, in Kuala Lumpur, in PJ, where they have no social connection. Where in their own old kampong, they used to live happily without any restriction. They can walk around, they can go and visit their friends and relatives, they can do what they like. But when they go follow the children to bigger cities, they feel a lot trapped. Yeah, and financial difficulties, as you retire, your income become less, you have to depend on children for financial aid or help. Or when you become old, you have physical problems or maybe medical issues, you have to spend more money, or you have to get a maid to take care of you. So there are a lot of his financial problems sets in, where your income becomes less, your expenses become more. So this also can cause a person to become depressed. Yeah.
Wow, thank you so
Yeah.
much for those insights, Dr. Esther. So, based on what you shared, how would you say depression is different in seniors in compared to younger adults?
So how the older people, okay. In general, early onset means the person developed depression before 50 years old. Um, Either in teenage also people can get depression. The first time they became depressed in the early adulthood or even before that. Late onset after 50 years old, that is called late onset depression. Usually early onset depression, often they have family history of depression, so it is genetically linked. Whereas elderly depression, less genetic link, because they went through hardship of life all throughout their life without having depression. And the later part, they develop depression is most often due to the situational problems, as I mentioned to you before in my previous slide, the reasons why the elder person can get depressed. And younger people, less often they have physical problem. Older people, many chronic physical illnesses. Often young people, they do have some personality issues, like maybe a perfectionist, narcissistic. Some people like that, they often at higher risk to develop depression. Whereas older people more, there are structural changes that happen in the brain. When you take the brain scan of people with depression, you can see lot of ischemic changes, not enough blood going to certain part of the brain. It is not the person should develop stroke. Even without stroke also, the person can have small little changes that is happening in the brain. And often they do complain of lots of aches and pains, which is not medically explained. So often it is the presentation in an older adult. Yeah. Okay. So when you come to the signs and symptoms, okay, there are psychological symptoms of depression where the person can feel sad, emptiness, they don't look forward for the day, they very often feel anxious for a little things over life, they lack the enjoyment, reading newspaper or doing some gardening or even cooking. Elderly ladies, they used to enjoy cooking. Now they don't enjoy cooking anymore. They used to enjoy the dramas and the movies and the TV. They don't sit in front of TV anymore. They tend to lie down. They feel very tired most of the time. They can have problem with concentration. They can have problem with memory. They come to memory clinic. Some of the patients, when they come to memory clinic for memory issues, it's when we get into the proper history, the memory issues or memory problem is not really due to dementia or Alzheimer's disease, but it is due to depression that makes the person to lose their memories. So when you treat the person's depression, the memory gets better often, and they have problems with sleep where they can find difficult to get into sleep, or they find difficult to stay sleep, or interrupted or disturbed sleep, or they wake up much early in the morning, usually about 2 hours or earlier than their usual waking time. They couldn't sleep anymore. They feel tired most of the time. They wanted to lie down on the bed. To get up in the morning to start the day is a big thing for them. Again, so they also can easily become irritable, cranky for nothing. For simple matters can make them feel very irritable. They can have guilt for no reasons, and they also can have suicidal thoughts. Suicidal thoughts among the elderly are really very serious. If they talk about suicide or anything, it is not a simple thing. We have to be very careful about that. Yeah. Apart from this psychological symptoms, very often they do have physical symptoms, medically unexplained aches and pains. They do have aches and pains from head to toe, any part of the body. This is not able to explain. They go to different doctors and get different treatment. Headaches, body ache, abdominal cramps, not able to digest food, or no appetite, constipation, gastritis. They go and do upper scope, lower scope, turns out to be normal. They go and do multiple scans and x-rays and blood investigations, turn out to be normal. In that case, very often it is depression, unless otherwise it's proven it is depression. So what happens with all medically unexplained aches and pains and bodily symptoms? They go and see doctors in different doctors and get different symptomatic treatment. For headache, they get some painkillers or Panadol. So gastric, they get some gastric tablet. For energy, no energy, they get some vitamins. So they end up overlooked. Their depression is being overlooked rather than being addressed, because they do not fulfill the typical criteria that is given in the textbooks. The symptoms 1, 2, 3, 4, 5, they don't fulfill. Rather, they come to the doctor with a lot of physical complaints. So they end up not being treated for the underlying depression. Rather, they get treated symptomatically. Yeah. So we do have some screening tools that we can screen depression. This is a very simple geriatric depression scale. Often we can be used in the primary care, in GP clinics can be used. If a person, how they feel about their life in the last 2 weeks, are you basically satisfied with your life? If the person says no, maybe depressed. Do you often get bored? Yes, maybe the person is depressed. Do you feel helpless? If yes, means the person may be depressed. Do you prefer to stay at home rather than going out and doing new things? Yes, means probably you feel depressed. You feel pretty worthless the way you are now. If yes, means probably you're depressed. If there is 2 points or more, then probably suggestive of depression. In that case, it is good that you go and see the doctor, get properly treated for the depression. The quality of life of the elderly really, really will change. It's treatable condition. That's a good thing about it. And again, there's only one single questionnaire that is called
Yeah.
Yale's Task Force. This is the only question: do you often feel sad or depressed? This single question, if the person says yes, this have the same sensitivity and specificity of the geriatric depression scale that I mentioned to you before. Yeah, the original geriatric depression scale is 30 item, then it went down to 15 item, then now we do have 5 item scale. And even to make it easier or simpler, this one question very often can identify or pick up depression among the elderly group. So if you suspect anyone, you think the person might be suffering from depression, a lot of aches and pains and complaints and irritability, cannot sleep, things like that, all the time lying down on the bed rather than getting up and doing things. So probably you can ask, do you often feel sad or depressed? Then probably the geriatric depression scale will become a little bit more finer tool. If you feel any of the elderly do have depression, please get treated. It can be treated with medications.
Mhm. Wow.
Yeah.
Thank you so much for those insights, Dr. Esther. I think we've learned quite a bit just in those last few slides. Are there any, or what are some of the treatments for depression in the elderly?
Okay, these are the medications that is available. That our common first line treatment is SSRI, selective serotonin reuptake inhibitors. There we have quite a number of medication on that list. If that doesn't work, then we go to the second line called SNRI group. We have few medications available. The other groups, I'm not going to talk about it because we seldom use among the elderly age group because of the bad side effect profile. So here probably we don't talk much about the antidepressants. But the good news is antidepressants are available that can be treated. Yeah, the elderly depression can be treated with medication. Okay, again, one should understand it's not just the medication alone. It is much, much more than the medication. So, medicine is not a quick fix, it is working together with depression. How to make the person to back on track. It is not just giving a tablet like a BOMO, go back, take the tablet, you're going to be well. No, not at all. It doesn't work at all this way. Just like diabetes, if you give a anti-diabetic tablet, go home, take the medicine, your diabetes will be all right. Never ever. You have to control your diet. You have to do regular exercise so that you burn your calories. Then only your diabetic control can be well controlled. Similarly, depression also not just the medication alone. That's why I didn't really talk about the medication. You have to make non-pharmacological treatment is equally important. So one is to stay active, busy. So the idle man's mind is devil's workshop. If you don't do anything, sit at home, do nothing, the devil will come and work on your mind, tell you're useless, you are not good as before, what for you're to live like this, your children don't love you, this and that, all the negative thoughts will come. So when you grow old, don't think makan tidur tengok TV. No, that's very, very wrong. So you still have to make the fullest when you're old. Stay active or busy at home. Get something done at home. Don't simply sit in front of the TV. You can, if you feel bored, you have nothing to do, take at one room at a time. In one room, one wardrobe you can take. Start to clear up all the unwanted old things. Then whatever you need can arrange nicely. So that will take one whole day. One single part of the wardrobe will take one whole day. So slowly you can take your own time to clear up the whole room. End of the day, maybe it takes 1 week or 2 weeks or more than that, you will feel a lot satisfied that you have done something good. Yeah, it's to look for things to do. You can't say I have nothing to do. That lot of things. If you look around at home, you can do a lot of things. So if you're good at cooking, if you love cooking, cook. That's good. It's just cook, and then probably you can go and give people who really in need of that. No need to cook a big bulk. Just cook little, so maybe can give to your friend who is lonely, who can't do much, so you can have the fulfillment. Okay, so have to stay busy is important, and to stay active is important. Physical exercise is utmost important, very very important. You have to walk as much as possible. It is important. You have to sweat after you go for your regular exercise. Then the body will produce all the chemicals that can be given through antidepressant medication, because your own body has that potential to develop the endorphins. Endorphins are important chemicals in our brain for us to feel good. So the National Institute on Aging has recommended physical exercise is most important, not only for physical health but also, remember, it is also important for mental health. So stay busy is important so that you don't give way for your negative thoughts to come in. Stay active is important so that your own body will produce endorphins, and get enough sleep, time to sleep. You don't try not to sleep daytime because it might affect your nighttime sleep. Yeah, so you have to see that if when you sleep daytime, if it is going to affect your night sleep, then try to avoid. But some really gifted people, they can sleep anytime they lie down. Yeah, that is a different issue. But in general, as you grow old, the amount of sleep that you require becomes less and less. Okay, and talk therapy or positive negative thinking. Yeah, if you give way to the negative thinking, the negative thoughts will come and conquer you. Maybe my son is no good, my daughter is no good, my house is no good. You keep on start to look at the negative part of the things, then mostly the negative thoughts will come and conquer you. So you need to replace with positive thought and thinking. So that also very important. You have to remain positive, very important. Don't give way for the negative thoughts to come in. And also, you have to be stay connected. That is very very important. You need to stay connected, socially connected, because when you are lonely, you often end up having unwanted thoughts and end up having depression. This during this pandemic, I've seen quite a number of my elderly patients are coming just because they can't do anything. They feel lost because children cannot come, they cannot go anywhere. They are usually they go for morning walk. After the walk, they go for yamcha. After yamcha, they talk and they come back home. They lost everything, so they feel a lot trapped and sick. Yeah, so it has to be stay connected. Okay, as much as possible, we need to be connected with family and friends. Yeah,
Yeah.
that is important. Yeah.
Thank you so much, Dr.
Okay.
Esther. Before we go on to the next question, we'll be taking any questions from the viewers in the last 5 minutes. So if you guys have any questions that have not been addressed now, we will get Dr. Esther to address your questions in the final segment. So do put your questions in the chat box. So Dr. Esther, thank you again for your insights. Could you maybe share then how can caregivers better support seniors that are dealing with depression?
Okay. All right. So it is a combined effort, not only the person, the caregivers around them, it's also. So simple things, little things can help elderly person with depression. Don't think, this is nothing much, this is not a big thing. Just inviting them for a out, just take them to the park, or just take them to the market or supermarket. Just that act is very helpful for them. Maybe they can know every Wednesday so and so is going to come and take me to go to the market. Uh, that sort of little things can help a lot. Yeah. So please remember, invite your older ones to go out. People become less depressed when their body and mind are active. So don't allow your body and mind to live, do nothing. Yeah. And then go for a walk. Maybe tell them, okay, 2 times in a week I'm coming in and taking you going for a walk. Maybe go and sit near the beach side if you have a beach, or you go near the mountainside if you have a mountain nearby. So anything, look around, you can get some activities. Or you can do some indoor activities with your loved ones, playing mahjong, playing some card games, snake and ladder, something, even though it looks simple, but the elder do get enjoy. Yeah, you can, it's the way how you can make it more creative and have regular schedules for them. Okay, that's what I was mentioning, like every time they know, okay, every Monday I can go this place, every Friday I can go this place, so they look forward for that day. Yeah, if they are going to go buying things for them, take them to the market, ask them to choose the fish they want, the chicken they want. So get them involved in activities. That is also very important. If they refuse, probably at that time you can leave them, then gently remind them when they are around. And be flexible, not necessary you should be very strict to the time schedule, have what time you wake up, what time you do, but have a structured activity which with some flexibility. So if a person is really all the time negative, and it is very useful tool that I use to advise my patients, and it is very helpful to list down their blessings. Yeah, if you look at the blessings, some, I mean, most of us, we do have more blessings than other, not a blessing like thing. They cannot complain. Maybe a few things to complain, but if you sit and count the blessing, write down blessing one. I can see today, I can wake up today, that's a blessing. I can drink water by myself, that's a blessing. That is a wonderful thing. I can go to the toilet, open my bowels, that is a blessing. Because many elder people, they do have constipation, they are so much worried about constipation is a big issue among the elderly group. You can open your bowels without any trouble, that is a great blessing. So you go and see for small little things, blessings in your life. The small other things that you are worried about will not be a big issue for you. So you can encourage your loved ones to count the blessings. Yeah, okay, that can be
Yeah.
done.
I think
Yeah.
that's very, very important. That's the perspective that a lot of us need to have to count the blessings, even the small things, right? So yeah, thank you so much, Dr. Esther. Would you say then, if suicide is more common in the elderly in Malaysia?
In elderly, suicide in elderly in Malaysia, it is not reported. We don't have any data on the suicide among the elderly group. So I am not able to comment on that. But I know the suicide rate in Malaysia is higher compared to 2019. 2020 became more, 2021 further became more, even the first quarter of the year in general. And they found 51% of the suicide were teenagers, young age group. So about the older age group, the suicide in Malaysia is not, this, I don't have a proper statistics. So if you look at the psychological autopsy, I mean, we know autopsy means when we do a post-mortem, yeah, that is called autopsy. But psychological autopsy means after a person committed suicide, we go back and look at the events and the things that had happened, the words that they have spoken, and then we come to a psychological autopsy thing that is called psychological autopsy to come to a conclusion of that particular suicide. So what they have found with the psychological autopsy, often those people who died of committing suicide, they do have depression. They have found out, and they do not receive medical or psychiatric attention. You see, that's why I told you before, when they have a lot of physical symptoms, doctors focus on the physical symptoms, overlooking the depression. So they don't get treated for their depression. So this is one of the findings they have found. And the elderly person, before committing suicide, they have communicated about their suicidal thoughts to the friends or family, or even to the doctors also. They have given some indication. Again, if they are openly talk, by talking openly about suicide, it can save a life. People can become very sensitive, especially doctors, when there is anything about suicide, they don't want to explore, they feel very sensitive issue, so end up losing the person. So talking openly and honestly can save a person. So remember, any talk about suicide, please take it seriously. It is just a, it's a warning sign, and the person is crying for help. Yeah. So it is important to
Yeah.
identify and prevent that.
And at the same time, Dr. Esther, how can caregivers also avoid compassion fatigue when they are caring for seniors or loved ones?
Okay. Yeah. Yeah. It is not a simple task. to care for an elderly person. To care for a baby or the child is a joy. It's a joy when the children make mistake or when they show tantrums. You just see and talk. I mean, it can be difficult sometimes, but and it's not so bad for the parents. And it's totally different if an elderly person is showing tantrum or irritabilities or not doing things that they want to. Maybe ask the person to come and eat, the person don't want to eat. So for a baby or for a child, you can take them, go out, show them things around, and then can feed. But the elder persons cannot. So the caregivers often they get burnt out. If you feel you're burnt out, please ask for help. Number one, ask, ye shall be given. If you don't ask, people wouldn't know. Maybe your sibling, you're not asking your sibling to help you. Maybe your sibling wouldn't know that you need a help, urgent help. So please open your mouth and ask. You can get some of the help. And if you feel you're really burnt out, please take time. If you are really, really burnt out, don't get burnt out totally. You have to take off time so that you recharge yourself and you can come and care for your elderly person, your parent, or anybody in a better way. Okay, so this is called Caregivers Training Index. So these are five questions: emotionally taking care of your elderly relative, physically taking care of your elderly relative, financially carried out taking care of your elderly relative. As far as your social life is concerned, how you find taking care of your relative, because you're so much focused in taking care of your mom and dad, you lose your social contact. That is wrong. Yeah. So overall, taking care of an elderly person, how much of stress is going through. Okay, if one means no problem at all, zero stress. If 2 to 3 means moderate stress, so you can tell them you feel 2 or 3, within the moderate 2 or 3. 4 or 5 you feel extremely stressful. See, yeah. So they can count. If your count is more than 17, then probably you need some help. Yeah. So please don't overlook your health. You need to take care of yourself. So it's important that you need to ask for help, take time off for yourself.
Yeah. I think before we take any questions from the crowd, one final question that we have is, are there any mental illnesses that get worse with age?
Okay. Most okay. The most common condition is Alzheimer's disease or any form of dementia. Dementia is a common terminology that we use. Under the dementia, there are many, many causes. One is the Alzheimer's, that is the most common cause of dementia. So, what is dementia? Dementia is a problem with memory. It's not just memory problem. They have problem in thinking, organizing, getting things down. This is right. This is wrong. Have to do things like, for example, making a cup of coffee is so simple for us, but those people who are demented, they don't know where to go first, what to do first. They have to boil the water first, then put the powder in, take the milk powder in, whatever. They totally disorganized. So they can't care for themselves. So they functionally they decline. They do have mood changes, not only memory problem, they know that something wrong going on with them. They can't cope with their life. They do develop problem with mood or depression. Then they can have changes in their personalities. They are not as pleasant person as before, or they can have problems in communication. They wanted to talk something, they really cannot tell it out to other person to understand. They couldn't express themselves. Their language will become a major issue. So they end up, they're not able to care for themselves. They can't ask for things that they wanted. And their reasoning power will become bad. Yeah, they cannot reason out, this is right, this is wrong, this can be done, this cannot be done. So end up they become so much dependent. It's become a second childhood. So if you can imagine a 5-year-old kid, how much they're dependent on me or on a mom or dad. Similarly, the older person also can become dependent. As the disease of dementia goes further down, depressed, further deteriorate, they can become much more dependent on the children or the caregiver, like a 2-year-old kid or even a 1-year-old kid, that you have to do everything for them. Yeah, that is slowly the dementia will progress from mild dementia, moderate to severe, where they become very much dependent on other people. So dementia is not a part of normal aging. Losing memory is not a part of memory, getting old or growing old. It could be due to a disease of the brain. So we need to know, we have to identify, come and get treated early. The medications are available, but I can tell you this is not a cure. Whatever medicine so far we do have is not at all a cure. It is a medication to slow down the progression of the disease, so that the person, whoever having the problem, can have a better quality of life for a longer period.
Wow.
Yeah.
Thank you so much, Dr. Esther, for that insightful talk with
Okay.
me and along with all the viewers. So much for what you've just shared. I think for the last 5 minutes, we'll take some questions from the viewers to address any questions the crowd has. So there's a question from Roshar. If you could elaborate a little bit more on talk therapy for elderly parents that always talk negatively about their family members.
Okay. Yeah. So the talk therapy example, those parents keep on talking negative about the children and in-laws. Uh, Maybe first thing we have to understand whether there is got problem in the relationship or not. That is important. um, whether there is a real problem. If there is real problem, probably we have to address. If there is wrong perception, if there is wrong perception by the elderly about the children, then they have to talk openly about that, about what is, maybe you have your own reason which your mom or dad don't understand. So when you explain to them that such thing is because of this, then probably they will understand. So this is more on uh, open communication between the two parties. Yeah. Okay.
Thanks, Dr. Esther. Another question from Vivian. An elderly experiencing depression due to immobility, sometimes unable to sleep for a few days and nights. Sleeping pills also didn't help. What could a caregiver do to help this senior?
So importantly, physio is very, very important, physiotherapy, to make them to do some exercise. In geriatric, in old age, if you don't use it, you will lose it. Any part of the body, either brain or hearing or whatever it is, your muscles, your legs, or whatever it is, if you don't use it, you will lose it. So remember, always you have to make the person active. If the person is immobile, I'm not sure to what reason, if it is a stroke or if it is due to arthritis, whatever, physically they are frail, you need to address. In whatever condition, we still, there will be a lot of input by the physiotherapist. It's not just physiotherapy is for stroke or anything. Even geriatric physiotherapy is very, very important. And occupational therapist also very important. So the treatment is more in holistic way, should be in a holistic way. If the person is so depressed, he won't be doing physiotherapy. If the, that is a ripple effect, then you don't do physical physiotherapy, your physical condition is going to deteriorate further. So that is one thing. Immobility is bad, immobility. So somehow or other you need to make the person to walk about. If the person is bed bound, probably make them to sit on the wheelchair. Give them a shower every day. Don't think the person is bedbound, I'm not going to give shower. If my patient is in the ward, I will make sure, I'll tell the nurses every morning, I need to this patient need to have a hot shower. You can see the difference. Maybe for 2 weeks they never had shower, then refer to me, telling the person is depressed. You give a nice scrub and shower, the person is so brightened up. It's not medicine, it's just by having physical touch. So make sure every morning the person is given a good shower, take to the garden or take to the open air, get some vitamin D from sunlight, do some gentle exercise to start with, slowly can do that. So if you don't do exercise, if you your body is not tired, you might not able to sleep well. So when you become tired, you can sleep well. So make your elderly parent tired during the daytime, and nighttime will be a better night, hopefully. Yeah. Okay. Sleeping tablet. There's a big issue, big topic on elderly people, whether to give or not to give. Before giving, we always advise on sleep hygiene. I think here is not enough time to talk about sleep hygiene. You can Google and look for sleep hygiene. So if you can follow the sleep hygiene, you can tackle some of the sleep issues. And if really cannot, then we do have some medications for sleep that can be used. Yeah.
Thank
Okay.
you so much, Dr. Esther. That was really, really helpful. I think we'll do one last question before we close the session. A question from Nawali. Most parents are left alone because the children are working. And if they are slipping into depression, usually it's memory lost, then the guilt sets in first, and they choose to keep quiet about it. How can children detect any early warning signs?
Yeah, that's why you have to keep connected with your uh, parents. You many of the children, they have already migrated to busy cities to find a living, and the elderly parents are left behind. And and maybe at the beginning they have their own group of friends. The circle of friends becomes lesser and lesser. They become more and more confined to the house, and they have nothing much to look forward for. So try and visit them as much as you can. At least you make a phone calls. Video calls are available. um, at least something to replace it. It is found it is not going to, the digital communication is not equivalent to physical communication being with them, but at least somebody calls and talks to the person, an elderly parent. It's really really helpful. Try to keep them in your loop, so that every day they know, every 5 o'clock or maybe every 8 o'clock, my son is going to call me from here. Every day, this time my other son is going to call me, their daughter is going to call. So this make a person to look forward for the time. Yeah. So they are left alone, they are totally lost, they don't know what to do, they don't know how to kill the time. When the day comes, they don't know how to kill the time, they end up sleeping. When the night comes, they couldn't sleep because they already slept in the daytime. So it becomes a vicious cycle. So you need to break the cycle. And they often do have memory problems because of depression also can happen. So in that case, you treat the depression, the memory can get better. Another issue, of course, the main underlying problem is dementia or memory problem, but that person also can become depressed because they couldn't cope with the loss of the memory and the independent living. So they can become depressed. Depression and dementia can go hand in hand, also can. So if you feel the person is depressed, that we need to assess, should bring to the professional doctors to find out whether the person is having depression, whether the person could be treated. How to identify my mom or the signs? So as I told you before, you can use the geriatric depression scale, the 5 item scale you can use. It's not for doctors, it's for public to use. Okay, so you can use that scale, or you can ask about their mood, how they feel about themselves, how they feel sad, if they have lost interest in the usual things. Then probably the person is have no more interest. It's also an important sign. Losing interest is the important sign. Feeling tired, lot of physical complaints, pain and ache. Every time you go back home, you have to end up seeing different doctors, but everything turns out normal. Then probably the person is having depression. So that means if you have low mood, not interested in things that they used to be enjoying before, and many physical symptoms are complaining, but no basic for that, then probably the person is depressed. You can also use the geriatric depression scale.
Thank you,
Okay.
Dr. Esther, for such a thorough answer to the question. And just for an insightful presentation today. Before we end the session, a quick disclaimer for the crowd. The health information provided today is just general information and for educational purposes only. It is not a substitute for any in-person professional health advice. To seek further medical advice for your medical condition, do consult your doctor or go to the nearest health institute to get the assistance you need. This video only represents the speaker's views on depression in the elderly. And once again, thank you so much for your time, Dr. Esther, and thank you so much for all the information you shared with us today. It was
Th- Thank you, Tanisha, for having me in, and thank you, Homesh, inviting me to for this talk. Thank you so much. I hope people enjoy